Well, and now is a fun time because we're in the summer. And so, we may have some school stuff going on, but it's not in full gambit like it was before. But as we start thinking about the next school year, which is crazy to already say, but starting to think about that, what should districts or superintendents be thinking about from a school health perspective?
I think this is the time of year when districts start thinking about who is it that's going to fill that role. If we don't have that role filled, how could we fill it in a cost-effective manner?
Yeah.
And so this is an option to be thinking about of how do you get all-day access to the nurse? How do you get access to immunization review? Someone has to do that work. Those are things that are required of schools. Is there a way that you can get someone to do that work for you, and so that your school staff can be freed up to do the rest of their tasks that they have to do?
Yeah.
So one of the things we do is the on-site staff has to help with the visit, but we do all the follow-up calls. We do all the charting. We pull it together. So we save the school staff that see the kids so much time on the back end.
Yeah.
So I think if they can be thinking about right now, what is it that we need to do to fill that role?
Absolutely. And where to invest that time and attention at. Yeah, absolutely. Well, and what conversations or what questions should we be asking them, or they be asking us to help kind of guide them to understand where those gaps are?
I think first off, we talk about safety, which I know safety and liability is always on a administrator's mind because they feel that burden of that in their school setting. But sometimes they feel like their hands are tied. So helping them to understand there is a cost-effective way that they can help provide more safety to their school staff. And it's not, you don't have to choose this versus that. It can be all-encompassing is a way we can help.
And then when you think about this too, I know like ROI and thinking of the budgetary perspective of this, that's always a conversation of anything right now. How do you explain, there are some situations where we can be that person and that's what this dollar amount would mean. And sometimes it's just we're that extender and not maybe the primary. How do you showcase the ROI from a school health perspective?
I think really when you think about school health is keeping kids in school. So we have a 90% return to class rate. And so there's a couple ways that you think about the ROI. You think about it that way because that saves the school. Their job is to educate kids. So if they're in school, they can educate them the best way they can.
Yeah.
We also think about with that return on investment, how do you use the school staff you have right now to the best capacity that you have? Who can you bring in for in a cost-effective manner to help with your safety of your school kids?
So what keeps you optimistic about the future of school health?
The kids. The kids are just the best. They have a freshness to them.
Yeah.
They have a way of just encouraging the adults around them, I think. In a lot of ways, schools are a very happy place. Now, that's not the case of everything, of every child. We do make child protection referrals.
Yeah.
And even though those are such heartbreaking situations, those also save lives. And I think about that impact too. And so I really think about the impact of school health as a life-saving program and a program that helps to really help kids to soar. And that should be encouragement to us as a society, because when our kids are thriving, our whole society thrives. And I think putting our thoughts toward that is really important. That encourages me a lot.
That's beautiful.